So hello everyone. A very good afternoon, good evening to all of you. I welcome you all to Homeopathic Musings. So today we have a very interesting topic, that is oral manifestations of systemic disease, and for that we have a very good, interesting and very good speaker, senior dentist Dr. Dhruti Mehta. I welcome you, ma'am, to our platform, and thank you so much for attending this.
Thank you so much.
So before going forward to the session, I will just have a quick look for our upcoming modules. Animal series. We have this 1-year course. It is already started in January. And on this month, we will have a live session on mammals. If you wish to join, you can soon register. Then maternal remedies. We have already started this course by Dr. Ghanshyam Galathia sir on the 1st August. And there will be 8 sessions every Thursday. Then we have a very clinical course on autoimmune disorders by Dr. Dinesh Chauhan sir. He is a very senior homeopath, and it will be a 2-hour session on 16th of August. Then Dr. Adin Tindhalwal sir will be coming to take cardiovascular disease, and it will be a 2-hour session on the 10th of the October, and early bird will end soon on 15th of September. So before going forward, I will just quickly introduce to our speaker, Dr. Dhruti Mehta. She is a dental surgeon, comes with the experience of 20 years in the field of dentistry. She is practicing at her own clinic. There is zero cavity in Matunga since 14 years. She is a certified implantologist and specialized in root canal treatment, pediatric dentistry, full mouth rehabilitation, and smile makeover. She is a lifetime member of Indian Dental Association and Indian Society of Oral Implantologists. She was also appointed as a dental surgeon on the panel of Kikabai Hospital Science. Thank you so much. And before going forward to our today's session, I will just have a quick look at basic hygiene factors. Please mute your lines all the while the speaker is speaking. Keep your videos on, which helps in the interaction with the speaker. Please raise your hand, or if you have any questions, you can just put it in the chat box. All the questions and comments will be addressed at the end of the session. Do not scribble on the screen, make notes, share your experiences, and enjoy. If you have any difficulties or inquiries, you can just contact on the given details. I will just stop sharing and hand over to ma'am.
Thank you. Thank you so much, Dr. Mansi. That's really nice of Dr. Preeti and Dr. Prajakta. The homeopathy using the institute that they are having and the kind of lectures and everything they're conducting, that's really wonderful. Looks like a one-stop solution for all the knowledge. Now, let me share my screen here. Are you all able to see the screen?
Yes, ma'am.
Okay, 1 second. Okay, so can you see the first page? So first page, I really love this phrase. Before starting with the topic, I would like to share this. The phrase is look, talk, eat, feel, smile better. It says a lot about the importance of healthy teeth and how they enhance various aspects of our daily lives. Look better because healthy teeth contribute significantly to our appearance. Straight, white teeth are often associated with beauty and health. Good dental hygiene and regular dental visits help maintain an attractive smile, boosting self-confidence and social interactions. Talk better. So if you have any missing teeth, of course, the pronunciation, your speech will be difficult. It will be affected. So teeth play a crucial role in speech. They help in forming sounds and words correctly. Misaligned or missing teeth can cause speech problem, making clear communication difficult. Eat better. Strong and healthy teeth are essential for proper chewing and digestion. They help us break down the food efficiently and also helps in better nutrition and overall health. So this is a very important point for even homeopathy doctors. If there are teeth missing, then the digestion is definitely affected because the crushing of the food is not happening properly. So overall health will be affected. Hence, it is very important to have the full set of teeth. Dental problems like cavity, gum diseases, toothache, It causes pain and hence difficulty in eating, chewing, and it causes dietary restrictions. Feel better. Oral health is closely linked to overall health. Poor dental hygiene can lead to infections which may also affect other parts of the body. Maintaining good oral health can prevent pain, discomfort, and more serious issues, contributing to a better overall sense of well being. Smile better. A healthy smile is a confident smile. Good dental care ensures that your teeth are in best condition, making you more likely to smile freely and confidently. Smiling also has a psychological benefit, including reducing stress and improving mood. I'm sure after this, I hope I see smile on everybody's face. Now, going to our main topic, that is oral manifestation of systemic diseases. So, basically, oral health is the foundation of overall health. The mouth serves as a mirror to the body, reflecting the health of the individual. Many systemic diseases are often manifest early symptoms in the oral cavity, making it critical area for early diagnosis and intervention. The relationship is bidirectional. Remember this. The relationship is bidirectional. It means that if there is a systemic diseases, you will definitely see some changes in the mouth. And also, because of the oral health is bad, the systemic diseases, the progress will be faster and the condition will be worsened. So the relationship is always bidirectional. The mouth is a part of the digestive system and is directly linked to the rest of the body through the bloodstream. Bacteria from oral infections, such as periodontitis, that is also called as gum infection, we'll be seeing that in detail later, is linked directly to the rest of the body through the bloodstream. So bacteria from oral infections such as periodontitis can enter the bloodstream and contribute to the systemic conditions, including cardiovascular diseases and diabetes. Dentists often encounter these first signs of systemic diseases during their routine dental examination. Recognizing these signs are very, very important because it can lead to early diagnosis and treatment. You can see in this slide that oral cavity is a mirror reflection to your overall health. See on the left that the tooth is linked to so many organs of our body, right from the heart diseases, mouth cancer, diabetes, gum diseases, tooth loss, bad breath, dental decay, lung condition, strokes, and so on. So understanding the oral manifestation of systemic diseases helps in making informed decisions and informed referral and collaborating with the other healthcare providers like homeopathy doctors. So dentists play a crucial role in healthcare team by referring the patient to appropriate specialists based on oral findings. So most of the times, the other doctors, finding out about the diseases. But many a times it happens that we as a dentist also find out about some oral manifestations of the systemic diseases and we can rule out. So then we can refer it to the right doctor. At the same time, there are certain diseases where, the other doctors, like homeopathy doctors, identify, diagnose. That time they see some oral changes happening in that patient. So for the right problems, they also need to refer to the dentist. Integrating, so now comes the main important part, that is integration. Integrating homeopathic remedies into dental care can provide a more comprehensive and patient-centered approach, addressing not only the physical symptoms but also the emotional and overall well-being of the patient. This synergy between conventional dentistry and homeopathy can lead to a better patient outcomes and more holistic approach to the oral health. Now, am I audible to everybody?
Yes, ma'am.
Okay. Please let me know if there is any hitch from my side. Yeah. So now before proceeding further, I would like to explain you what is normal first. What is a normal tooth? What is normal gums? What is a normal tooth gum relationship? And how a healthy tooth and a gum looks like. So basically our tooth is having a two part, that is a crown and the root. The crown is what you see in the mouth and the root is what is there inside the bone. Crown is, with the help of the crown we chew our food, and with the root we give the foundation of the crown is there, the tooth is there. Okay, now this crown and the root is surrounded with gums and the bone, that is called as a periodontium. Okay, that gives support to the tooth and that gives the anchorage to the tooth in the mouth. Now this crown or this tooth has 3 layers. The outer layer, as you all see in the picture, is called as enamel, which is a white layer. The middle layer is also called as dentine, and the inner layer where you have nerve fibers innervation, that is called as a pulp. So this is how a normal tooth looks like. And now this tooth is surrounded with gums, and this gum is supported by bone in the mouth. Going to the next slide. Now you will also, I would also like you to know that what is a cavity. And why would I like you to know is whenever a patient comes to you with a toothache, it is very important that, of course, the normal painkillers can be given to alleviate the pain, but tooth is the area where, if there is any infection, any diseases or the cavity, unless and until mechanical debridement of the tooth is not taken place, the cause of the infection has not been ruled out, medicine will just temporarily lessen the pain, temporarily reduce the infection, but the progress of the disease cannot be stopped by the medicine. You have to mechanically treat the tooth. So this cavity generally is basically what is when the bacteria attacks the tooth, it forms kind of a hole in the tooth, and then they go deeper and deeper towards the inner layer of the tooth. When they are in the outer layer, when the cavity is in the outer layer, that is enamel and dentine, you can definitely excavate the cavity and do a filling, which you all must have heard of recently. And then if the cavity has progressed further towards the nerve of the tooth, then it becomes a root canal. I'm sure many of you must have heard it, many of you must have got it done, many of you must have scared of it. But don't worry, nowadays dental procedures are very, very painless. So why I'm mentioning a root canal is when the infection reaches the nerve, then the infection through the nerve reaches to the root of the tooth and affects even the bone of the tooth. This becomes an alarming sign. If still not treated, the patient keeps taking the painkiller and reduces the pain, or sometimes the patient does not feel the pain, then it can convert into a abscess. An abscess is a full focus of infection. You can see in the image, the very first tooth on your right is the tooth with an abscess at the end of it, the red area. Okay, so such cases, if still not treated, the patient will have full swelling in the mouth. You will see some patients having a swelling in the mouth. Still untreated, just by mere taking painkillers or antibiotics, patient might feel a little better, but the infection is still progressing further. So it's very important to do to refer the patient at the right time, so that we can not only reduce the treatment, but also can give you the correct treatment and reduces the time, money, and also the stress for the patient. Now going to the periodontrum, which is a very important part that I would like you all to understand, because the blood supply to the periodontrum is the same blood supply to the whole body. So the infection also is related to both. So the relationship is vice versa. Now the normal tooth is surrounded by the gums and the bone. Okay, now in healthy individuals where there is no infection and the teeth are clean and all, you'll see the nice pink gums, not bleeding, and white color teeth. Now, what happens is over a period of time, there is something called as a plaque and a calculus that gets deposited. Now, what is a plaque and a calculus? In our term, it is also called as tartar. Basically, it is a hardened dirt which gets deposited over the teeth. Now, this is nothing else but our saliva. There are some minerals, food particles, infection, and also there's some dirt, which all gets mixed up and gets deposited over our teeth. So when it is soft, it is called as plaque. With the help of the brushing, it comes out easily. But once it becomes hard, even if you brush a lot, it is not going to come out unless and until professionally the teeth have been cleaned. So dentist does this job. Now this plaque and calculus has lots of bacteria and lots of strength to eat the bone. So when in the initial stages, you have gingivitis, that is the infection of the gums. Gum is also called as a gingiva. So in the initial stages, you will see bleeding gums, you will see spongy gums, you will see, swelling in the gums. The patient will just touch the gum or brush a little bit and the gums will start bleeding. That is initial stage of the infection. Slowly, if you see in the picture on the right side, this tartar gets deposited between the tooth and the bone, and it starts eating up the bone. And that is where the foundation of the tooth gets affected and the tooth starts moving. And let me tell you, once the tooth starts moving, we cannot do anything but we have to remove the tooth. So very, very important to make sure that the periodontium is very, very in a healthy condition. Now, this is an alarming disease. Why? Because if you have a cavity or if you have an abscess, body will show some sign in the form of pain, swelling, or even cavity. But in case of periodontitis, there are hardly any signs that patient will show. Patient will not have any pain. Only thing is bleeding gums, swelling, or some bad breath from the mouth will be seen. And patient will see some mobile teeth. The patient is aware. So, the progression of the disease keeps happening, but we miss the sign. And by the time the patient comes to the doctor, the disease has been progressed so much that we end up losing teeth. So it's very, very important that the patient at least regularly goes for dental visit, that is once in 6 months, and get his teeth checked. Now, coming related to this topic, so it's very important that we understand when do we refer patients to the dental specialist. So severe or complicated dental conditions like abscess, fractured tooth. Abscess, we already saw. What is a fracture tooth? Is that when some hard substance comes in between and the tooth fractures. So unlike the bone, tooth does not heal, tooth does not form new cells. If there is a fracture in the tooth, the fracture line will progress further and it will split, but you cannot join these two segments. And this becomes a very painful condition, because if the patient touches the upper and the lower tooth, or patient tries to bite something on that side, it's going to be very painful. Then is the severe gum diseases, as we already saw, periodontitis. Then is the oral care suspicion. So recently we had few cases where the patient had ulcers and patient had visited physician without examination just prescribed antibiotics. After 15 days the ulcer did not heal. Physician finally referred the patient to the dentist, and what we saw was the ulcer, but was not a very good condition. It was not something in a good oral hygiene area. So immediately we got the biopsy done, and it was a squamous cell carcinoma. So it's very important at the right time. If this referral has been done, then the arrest of the disease can happen at a very earlier stage. Then is the toothache, because again and again I'm telling you, whenever there is any pain or any symptom or sign in the mouth regarding pain or infection, believe me, the medicines will just give a temporary relief unless and until you remove the cause of the pain or the infection and treat the tooth and the gums, the problem will still progress. Routine dental care, as I already said, that why we have to regularly visit the dentist, so that a bigger problem can be avoided, and at a very onset of the problem we can address the issue and treat the problem. And orthodontic needs, it means alignment. Teeth alignment is a very important part of the treatment, because if the teeth are not aligned properly, it leads to food lodgement. The area is not self-cleansable. Hence, in future, the patient will continuously have cavities and gum problems. At the same time, when the teeth are not aligned well, the load of the mastication is not distributed equally in all the teeth. So the teeth which gets the maximum load gets worn out over a period of time, hence affecting the life of the teeth and longevity of the teeth, and oral health will be affected. Now that was about teeth, gums, and periodontium. Sorry to tell you so much in detail, but it would be difficult for me to explain the main topic without explaining with this in detail, that why teeth becomes an important part and why we need to refer and understand and at the right time. Now comes the main topic, that is common systemic diseases with oral manifestation. So there are many diseases which has oral manifestations. Some of the regulatory diseases that we as a practitioner, as a dentist, and you as an homeopathy, that we commonly see are diabetes mellitus, cardiovascular diseases, pregnancy, HIV, gastrointestinal disorders, blood disorders, stress, nutritional deficiencies, Alzheimer's, and others, which I'll be covering. So now going to the first thing is the diabetes mellitus. Diabetes mellitus, as you all already know, there is increase in the glucose level of the blood. The regulation is not happening by the body. So in such patients, you basically see that patients have periodontitis, that is gum infection you see in the picture, which is characterized by deep pocket formation, tooth mobility, and eventually tooth loss. It's again a two-way relationship. The picture shows two yellow arrow. That is means it's a two-way relationship where diabetes can increase the gum infection. Severe gum infection now again increases the blood glucose, hence affects the blood glucose control, exaggerating diabetes. So poorly controlled blood sugar level can lead to more severe periodontal issues. Inflammation of the gum can increase the again insulin resistance, making diabetes management very, very difficult. Also, in such cases, you see dry mouth, and dry mouth also leads to cavity formations, bed breath, and oral infections. And in such patients, when there is an infection, the healing does not happen, leads to pus formation and complications, and complications. So again, I repeat, it's a bidirectional thing. So a lot of diabetes patients are seen mainly by the homeopathy doctors. So, we would want that whenever you are checking such patients, is it like, we would want you to check the oral health as well. And such patient needs to be referred to the dentist. Now, next is cardiovascular diseases. Now, in cardiovascular, basically, you see that the chronic inflammation of the gums and the periodontal tissues can contribute to heart diseases. Bacteria from infected gums can enter the bloodstream, and also it can lead to formation of the arterial plaque, and which can result in heart attack and strokes. So what happens is this oral bacteria can enter the bloodstream, attach the damaged area of the heart, causing the infection, which is also called as endocarditis. And also patients with, having blood pressure since a very long time, and they've been taking this medicines called, for example, nifedipine. In such patients, we see there is a gum swelling, there is the periodontium gets affected, there is bleeding gums, and hence, the periodontal problem starts and the tooth problem starts. So, in a mutual integration between the between the diabetologist and the homeopathy doctors and the dentist can help the benefit the patient well. Now, next that what diseases that we are going to see, not a disease, basically pregnancy. So pregnancy again, in India, it's a very big thing, because generally what happens is they are so scared, females and the family basically scares the patient. And, here in India, it's not a regular practice to see dentists during pregnancy, but in Western countries, during the pregnancy, they regularly see dentist every 3 months. Sorry, can I take a pause for a second?
Sure, ma'am.
I want to stop share and share from a different this thing here. The 1 second. Huh?
Yes, yes.
Yeah. We were at 1 second. Yeah, we were at pregnancy. So what happens is, so coming to the thing is, in Western countries, every 3 months the dental checkup is must. They make sure that the dental hygiene is being taken care well, because on the labor table they do not want a dental pain. That is why. So periodontal disease is linked to premature birth and low birth weight. Yes, this fact is hardly known, but it's in fact rural areas, one of the common reason for miscarriage is periodontal health. The inflammation and infection can release these chemicals into the bloodstream, which can affect the fetal development. Now, there is some evidence that also shows that periodontal disease may be linked to preeclampsia. That is a condition which is characterized by high blood pressure during pregnancy, and which is mainly caused by periodontal infection. So it's very important that pregnant women also regularly take care of the dental health, and the dental health also been given equal importance. Now, next is nutritional deficiencies. So vitamin B12, especially vitamin B12 deficiency, it leads to regular ulcer formation, also glossitis, and angular cheilitis. It becomes very difficult to treat such patients because there is a constant complaint from the patient as burning mouth. And also iron deficiency anemia can lead to patient with atrophic mucosa and increased infection susceptibility. So these patients have very high chances of infection susceptibility. Okay, so HIV/AIDS, you all know that already the immunity of the patient is very much compromised. So thus such patients, you see that very recurrent infections, fungal infections like oral candidiasis, viral infections such as hairy leukoplakia, bacterial infections which leads to necrotizing ulcerative periodontitis. So such patients also will show very clear oral signs of the disease. Next is gastrointestinal disorders. So where there's a constipation or there's an acidity, the mouth will always show first because body is like a closed pipe where the mouth is the opening. So any problem in the pipe or the body is first seen in the mouth. Such patients come with ulcers. Also, when there is a lot of acidity, so GERD, it leads to enamel erosion because there's an acid formation, there's acid regurgitation in the mouth, and enamel literally melts, it gets eroded due to this acid. And patients will complain of sensitivity. You will see the teeth going yellow. There's a wearing of the teeth becoming shorter. Crohn's disease, the same patient will have a lot of ulcers in the mouth, which also resembles after stomatitis. So important again is to diagnose. Next is the blood disorders. So as I already said that anemia, patient present with mucositis, there's a pale mucosa, there's a red tongue, glossitis. Leukemia patient will have gum enlargement, bleeding, increased infection risk. Next is very important topic. I would like you all to really pay attention, stress, because we all practitioners are regularly seeing this patient with heavy stress, lot of stress, having lot of symptoms in the body, and teeth also shows these symptoms. So what happens is stress can impact oral health because the mouth is one of the most sensitive part of the body. So disruption in the balance of the jaw causes tooth and jaw related problems. Now, if you are physically stressed, what happens is via poor posture, overly vigorous exercise, dysfunctional breathing, or previous injury, the muscle in and around the neck and the jaw, they tighten and go in the spasm. So this creates a pain pattern that can cause to clench your teeth, which is also called as bruxism. Many of the teeth have, do have a habit of grinding their teeth or clenching their teeth. Now, this grinding, clenching, or bruxism, it leads to headache, neck ache, then a jaw pain, the back pain, cervical spondylosis, cracked teeth, sensitive teeth. So it's very important that we diagnose patients with stress and give the treatment for the same thing. Next is pregnancy that we already saw, nutritional deficiency, Alzheimer's disease. Now, what happens in Alzheimer's is that there are inflammatory pathways. This chronic inflammation, again from the periodontal disease, it has been linked to the development and progression of the Alzheimer's disease. Bacteria from the mouth can travel to the brain, contribute to the inflammation and plaque formation, which is associated with Alzheimer's. So it will help in progression of the disease rather than arrest. So again, an important disease. Others. In others, basically chronic irritation from a sharp tooth. Now, we all know as doctors that if there is any irritation or any chronic disease in the body, which patient takes it easily will lead to progression of the disease in a very wrong way. So if there is a sharp tooth which is hurting, or there is an ill-fitting dentures, or there are non-healing ulcers, or there is any injury inflicting habits, we need to stop them. We need to stop at the right time. We need to treat the sharp tooth. We need to correct the ill-fitting dentures. We need to make sure that the ulcer is healing in its right time. The patient is completely, fine. There is no sign of any inflammation. Otherwise, in future, this will lead to tumor growth and cancer. So again, important is to diagnose. As during the entire speech, I kept saying about diagnosis, because if we will not be able to diagnose, we'll not be able to help the patient. So comprehensive oral examination is very, very important. How do you do it? The technique is basically checking the mouth, the tongue, the soft tissue, and everything. If you visually you inspect, then you palpate the temporomandibular joint, you palpate any swelling, any lump that you see, you check the radiographs, and if required, get the biopsy done. Identify the red flags, that is unusual lesion, persistent ulcer, unexplained swelling. Patient history to be recorded, any medical complications past, present, any medications that the patient has been taking, any allergy that the patient is having. Importance of the detailed medical history is to be understood well, as we already talked about lot of diseases having lot of oral manifestations and how the oral health will progress the disease, and correlation between the systemic symptoms and oral findings. Interdisciplinary collaboration, as I already said, it's very, very important. Coordinate with the medical and homeopathic practitioner for holistic care. Now, how do you prevent and how do you manage? So preventive strategies, again, oral hygiene education. That is where India is lacking. Oral hygiene education is not very commonly available, but we need to educate the patient about 2x, that is 2 times brushing, 2 times gargling, and more than 2 things, that is brushing and gargling and flossing is very, very important. 2x is, that is 2 checkups in a year. Regular dental checkup is must. Management protocols to be followed, customized treatment plan according to the patient psychological, physical, and also the oral health. We need to plan the treatment. Pain management has to be taken care by the medicine, but infection control has to be done using conventional homeopathic approach, as well as treating the lesion is very, very important. Nutritional and lifestyle advice, as I already said, the vitamin deficiency, the nutrition deficiency has to be ruled out, and lifestyle needs to be addressed. Dietary modifications to support the oral and systemic health, and stress management technique. That was me, Dr. Dhruti. That is me from Zero Cavity, and that's my team telling you all hi. So remember, teeth or no teeth, we are always there to help you. We are located at Matunga Central, and you can connect to us on this number. And we have our email ID and website as www.zerocavity.in. Thank you so much. That was the end of the lecture. Now we can take up the questions.
Sure, ma'am. It was a very interesting, and it's like it's very important to have this in our regular practice. Actually, we basically many times our oral conditions are neglected.
So what happens, because the patient also goes through a lot of systemic problems.
Yeah.
Like the attention goes to those bigger problems, and that is where, we miss out on the oral symptoms. Yeah. But yes, if that also is diagnosed and identified at the right stage, then we can definitely help the patient in a better way.
Yes. All to the all participants, if you have any questions, please put it in the chat box, or you can just unmute yourself.
I guess participants have understood so well, or they have not understood at all. There are two possibilities.
No, ma'am. The lecture was very interesting, and we understand, and you have given a very inquisitive, and it's very helpful for us in our regular practice, in our general way. Yeah.
Thank you so much.
There is one question by our Dr. Chanda Shah. Cause of recurrent ulcers.
Yeah, so Dr. Chanda, nice question. Cause of recurrent ulcers, one of the main reason is, so again, you can divide into local and systemic. So first of all, local is if there is any sharp tooth which is, causing the ulceration, or any habit that the patient is having which is causing ulceration, or systemic. In systemic, you have first is the nutritional deficiency. So in India, we are all lacking vitamin B12 and folic acid, vitamin D3. So this is one of the major reason for recurrent ulceration. And other nutritional deficiency also leads to the recurrent ulcers. And gastrointestinal disorders. The patient is constipated. we see ulcer formation very, very highly, common in such patients. So recurrence is more in such patients. Okay, so the next is Dr. Nikita is asking, can you please tell about brushing techniques? Yes, brushing technique basically, just give me a second. I'll come up with the brushing model. The brush and the tooth model. 1 second. Huh? I will show you how to, what is the right technique of the brushing. Thank you, sir. Welcome. So these are our teeth. This is the toothbrush. Most of the time what we do is we brush and cover the teeth surface. And we forget the area which is here, which is a joint between the teeth and the gums. And that is the main area where the food gets stuck, when the tartar gets accumulated. So whenever you are brushing, make sure the brush is vertical strokes as well as horizontal strokes. And your brush has to reach the gum line. You have to touch the gum. That is the golden rule. Okay. So brushing like this, consider a comb and you have to clean the comb. So that is how you clean. Go to the right till the back area. Make sure the toothbrush is smaller in size so that all the teeth and as well as all the area of our mouth has been covered. This area, that is the lower teeth from inside, is most of the time neglected. That is the area where tartar gets accumulated. So keep your brush vertical and brush that area. Even inside, you have to make sure you touch the gum line and brush. Same thing on the right, left, upper and lower. And when it comes to the chewing surface, press the brush a little bit and brush. Okay, and make sure you clean the teeth properly. Okay, so again, 5 tips to remember is touch the gum line, keep the brush at an angle. Don't keep it straight, keep it at 45-degree angle. Start from back to front, circular motion and the vertical, and on the chewing surface, press the brush. Okay. The next thing is why a patient feel teeth are sharp. Why? Because the patient might be having a teeth grinding habit, or if there is a cavity or something like that, then the surrounding area becomes sharp and in between you see a shallow cavity. So that is where the patient feels teeth are sharp. Or the tooth is not placed properly in the mouth. There is a misaligned tooth. Then that particular tooth, the location might make it sharp to the tongue or to the lip or to the cheek. Very important to notice this and go to the dentist and get it corrected, because a sharp tooth, very commonly seen, has led to cancer formation on the tongue, and the patient has lost the tongue and the mandible also. What could be the reason behind halitosis without any tooth disease? How to maintain mouth hygiene? Thanks. Dr. Alpa, this is one of the best questions. Could you address this? So halitosis, also called as bad breath. Now, there are 2 reasons. One is local and systemic. Local, as I said, tartar and plaque formation, cavity, food getting stuck, any tooth with the infection, wisdom tooth problems that can lead to the bad breath. Now, systemic. So, systemic first is basically dry mouth. Okay. Second is dry mouth can be because of the diabetes. So, as I said, mouth is the opening of the body. So, if there is any problem in the body, it will lead to the bad breath. Okay. Patient having intestinal problems, gastrointestinal problems, bad stomach infection, lung infection, congestion, nasal congestion, diabetes, as I already said. These all patients will have bad breath. Even, the sleep disturbances also. You must have also noticed when, sometimes when we have not slept well, 1 or 2 nights regularly, consecutively, we'll have a little bad breath. Then I hope that answers your question, Dr. Alpa. Dr. Khushbu is asking, what can be the cause of bleeding while brushing or after brushing? Sometimes I have bleeding if I rinse at last or use fingers to clean for the final rinse. Okay, good. So reason for the bleeding is definitely there is some kind of an infection in the gums. Also, so local cause is there is tartar or plaque formation. So you need a dental cleanup. Also, if the brush is very, very new, then it can lead to bleeding episodes. Or the patient has a habit of brushing way too hard, then it can lead to bleeding gums. But the systemic reason is vitamin C deficiency. Also, in patients with systemic problems, you see gums which are swollen, like a periodontal, like diabetes or cardiovascular diseases. Patient having chronic BP problems and taking medicine for the same. Such patients will have swollen gums, and such patients will have bleeding gums episode. Dr. Gauri is asking cause of the excess salivation. Cause of the excess salivation, there is no particular cause for the excess salivation. The body is such producing extra saliva. There is nothing wrong about it, but keep sipping water and make sure that you hydrate well. Dr. Gauri is again asking what systemic disease caused gingivitis. As I already mentioned, gingivitis and periodontitis, almost all systemic diseases which has, the blood circulation involved will show some signs of gingivitis. Like cardiovascular disease, as any heart problems, endocarditis will show gum infections. Patients having chronic blood pressure, patient having diabetes mellitus will have a very bad periodontium. So all these diseases, even I said Alzheimer's diseases, it shows some kind of gum infection. So all these diseases will show gum gingivitis.
Yes, so I think participants got their answers. Any more questions? If you want, you can just ask and unmute yourself. So I think, ma'am, that's all for today. Like everyone got their answers and no more queries and such. So thank you so much. Thank you so much for coming to our platform and giving us a very insightful knowledge about dentistry.
Thank you. Thank you
will
so much.
help in our practice, and yeah, we'll definitely see how we can see these things in our patients and help them.
Yes, and even we also need to understand the psychological part of the disease and need to refer. So basically, we treat the dental part of it, but the
Yeah.
disease always has a psychological part. You all,
Yes.
as a homeopathy doctor, you all know really well. So that can be treated by you all, and we can take care of the dental part of it.
Yes, that integration will help patients in a very beautiful way in their journey to health.
Yes, agreed. Absolutely.
Thank you so much, ma'am.
Thank you so much. Thank you everyone for being the nice audience. Thank you so much. Thank you, Dr. Mansi.
Thank you, ma'am. Thank you.